My name is Jeannie Hoffman, and I'm a clinical psychologist and professor in the Department of Rehabilitation at the University of Washington School of Medicine. I am also the co-principal investigator of the BRIGHT study, the Brain Injury Rehabilitation Improving the Transition Experience. BRIGHT is a PCORI-funded study that really works to help individuals and providers determine the best approach to transitions from inpatient rehabilitation to the community after moderate to severe TBI. Long-term disability is really important to us, and we know that TBI is a chronic condition that we need to address. And looking at these ways that we transition from inpatient rehabilitation can be very important for people in order to ensure that they get adequate care and connection to all the resources they might need to either prevent future problems or treat the problems that they have in an ongoing way. In our work looking at TBI as a chronic condition, we learn from individuals and their families that they often don't get what they need when they go out from the community. And there's a lot of inconsistency in the approaches that different hospitals take in how they make that transition.
Hi, my name is Jesse Fan. I'm a professor in the Department of Psychiatry and Behavioral Sciences and an adjunct professor in the Department of Rehabilitation Medicine at the University of Washington. I'm one of the principal investigators of the BRIGHT study. Our goal was to develop and test a case management strategy to help people who've sustained a moderate to severe traumatic brain injury make a smooth transition from inpatient rehabilitation back to community living or a care facility. So we developed a case management approach, which we call the Rehabilitation Transition Plan. So the first goal is to identify and help address unmet needs within the 6 months following discharge from inpatient care, and using a comprehensive needs assessment and a highly person-centered approach. And finally, prior to the end of the program, TBI care managers ensure what we call a warm handoff by personally linking patients and caregivers with appropriate healthcare providers and community resources.
My name is Leslie Kempthorne, and I'm the research manager for BRIGHT, our PCORI-funded study. From the beginning, we carefully thought through ways that we could help build relationships among the stakeholders. We wanted to foster a strong team connection. First, we established annual in-person meetings with the stakeholders and study staff. For the first 2 years of the study, prior to the pandemic, our ability to meet in person was an important component for building connections across the team. We also started doing check-ins at the beginning of the monthly virtual meetings to see how everyone was doing. We made a point to set aside time to acknowledge important personal milestones, like celebrating birthdays or sharing well wishes for an upcoming surgery. It was important to us that time was provided to get to know one another on a really personal level, which helped to form a strong team bond.
I'm Deborah Crawley, a member of BRIGHT's professional stakeholders team. We created an environment where everyone on the team knew that they had an equal voice. It didn't matter what your background was, your opinion had the same value as everyone else's. We made sure everyone felt heard and understood as we shared a passion for brain injury awareness and support. Everyone had a different relationship to TBI, whether that was through lived experience in a research setting or working with individuals who have a brain injury. Everyone brought a unique perspective to the table. The study staff communicated very clear expectations. We stuck to a consistent structure for each meeting. First, we always made sure to check in and say hello at the beginning. Next, we would recap the previous meeting content. Then clearly illustrate the purpose of the current meeting and our agenda. After going through the agenda, we'd spend time catching up with each other's lives and end with any action items for stakeholders or staff to take before we see each other next.
We established several strategies to make it easier to engage. We set recurring meeting times with a consistent format for the agenda. That helped people plan ahead. Before each meeting, we sent email reminders with the Zoom link so people could just click in. We included clear agendas and generally sent meeting documents a week in advance for people to review as needed. We created a study website and uploaded the meeting recordings, agenda documents, etc., for all of our stakeholders to access, especially if they'd missed a meeting. Finally, we let stakeholders know that they could reach out to us via text, phone, or email when they had any questions or concerns. These were just some of the strategies we used to make participating as easy as possible.